Alright guys, I was asked to cover respiratory therapy. Now, in full disclosure, I've never worked as a respiratory therapist. I have worked with them as a nurse and a CNA. So I'll give a little bit of my experience working with them. I, of course, do not know the full extent of what they do. I am absolutely no expert on respiratory therapy. But I will definitely give my advice, what I've done with them, and some facts and figures. So let's go ahead and get started. The respiratory therapy program is a 2-year program. So I'm going to go ahead and compare it to the ADN program, as it's almost as apples to apples I can get in nursing, as you know, nursing is my field. So respiratory therapy is 2 years and 72 credit hours. The ADM program, at least here locally, is 2 years and 66 credit hours. So the respiratory therapy program is just a little bit more in-depth, but the same amount of time. In theory, of course, there's always some things, you can't really get classes at sometimes or what have you, but it is 72 credit hours as opposed to the ADN program that is 66 credit hours. So a little bit more in depth, and that is probably due to the fact that respiratory is more specialty than nursing. Of course, in nursing school, they really teach you med-surg, and then you kind of go to your specialty later after you graduate. Whereas respiratory therapist, you're pretty much going to be doing that thing once you graduate. You understand that is what you're going into, and there's not really a med-surg respiratory, job. Speaking of jobs, at the moment, locally, there are 19 respiratory therapist jobs here in my area locally. Compared to ADN, RN jobs, there are 934. So it just shows you the nursing shortage. Also, it's going to be a little bit more competitive to get into a respiratory therapy job as opposed to a nursing job. What are you going to make? So normally I look these numbers up on Indeed. However, Indeed told me that the national average for respiratory therapist is $8.38 an hour. I decided not to use those numbers. The community college that I got my credit hours from gave the stat that a typical respiratory therapist is $43,000 to $59,000 per year. That's $20.67 to $28.37 per hour. So a little bit of quite a bit of a range there that you can make. I guess it depends on where you go to work at. Once again, I'm in North Carolina, so these are North Carolina facts and figures. May be different wherever you live. An ADN can expect to make $43,000 to $52,000 a year. Again, that's $20.67 an hour to $25 an hour. So you're going to make a little bit more as a respiratory therapist, but not a lot more. The difference of $52,000 and $59,000 is $7,000 a year. And that was a difference of $3.38 or $3.37 an hour. So a little bit more on the higher end, but starting out at about the same on the bottom end as a respiratory therapist. Now, let's get into what I know about respiratory therapists. Like I said, I've worked with them as a nurse. I've worked with them as a CNA. I actually assisted some things as a CNA. I have not ever really assisted anything as a nurse. They have assisted me as a nurse respiratory therapist, especially when I was going to go get my trach and vent certification so that I could assist with trachs and vents. So I was really with them a lot for that when I went through that certification. That was about 3 years ago. So back to what they do. So as a respiratory therapist, of course, you're going to deal with breathing. One thing you may not think about that you're going to have to deal with is collecting sputum, or as I like to call them, loogies. That's right. You're going to have to deal with the gross stuff that comes out of people, out of their noses and out of their mouths. One time in particular, I remember collecting a sputum sample out of an individual. We turned them on their head by lifting the bed up at the feet, and the respiratory therapist told the individual to cough, and when they did, this great big gross green thing come right out of them. just a big old pow, and it was pretty gross looking. As a respiratory therapist, you are going to have to collect that. That big old green nasty grossness, yep, you get to deal with that. You are going to have to collect that. Now, as nurses, we do also collect things like that, and we deal with poop and pee. So, even trade, I don't know. A lot of people can't handle when things like that come out of people. Sputum can look really gross, especially if there's some sort of cancer going on. I've seen sort of like a coffee ground looking sputum before, kind of bloody and whatnot. So you're going to have to collect things like that. Another thing you're going to have to deal with is trachs and vents, as I've mentioned before. They go in here. There are various different types of trachs and vents, and to be quite honest, I let my certification expire and have not kept up with it, and I have forgotten quite a bit of the names of things because I didn't keep up with it, so I've forgotten it. But a lot of times these trachs and vents, where when you see people breathing through the little tubes in here, these cannulas, they actually come out and they have to be replaced every so often. Sometimes it is the nurse doing it, but a lot of times it is the respiratory therapist doing it. So you're going to have to replace that thing. There are also, so these trachs and vents, or the trach, goes in, the cannula goes in, but there's an actual piece that stays in there. And that actual piece needs cleaned around it, and you're going to get some grossness out of it. And sometimes that actually needs replaced itself. That is something that the respiratory therapist is going to do. A lot of times the nurses will keep up with the bandages that goes around them. There's like a bandage that holds it. There's also, sometimes, not always, sort of a balloon in there that you fill up, much like a catheter, inside of there to kind of hold it in there. Now, when these things come out, people cough. You really aggravate sort of that cough reflex when you pull these out. And when they come out and they are sick, things come out with them. Again, that sputum. I changed one time at the VA, and this person shot that mess across the room at me. I mean, I had ducked out the way. It came out with some force. A lot of times you're going to clean these things out and they're going to come out with some force. Another thing you're going to have to do is you're going to have to suction these people. Nurses can only do so much with these trachs and vents, and the respiratory therapist is going to have to do a lot. I keep saying trachs and vents. I'm really just talking about trachs right now. Just trachs. I don't know why I keep saying trachs and vents. I'm sorry about that. But with these trachs, when they have to be cleaned, they have to be suctioned. You're going to be in charge of cleaning and suctioning these things. And to be quite honest, I never really liked doing the cleaning. I never really liked seeing the cleaning or really anything with the trachs, because you are blocking the airway really when you do a lot of things with these. And it always kind of creeped me out. You want to keep the airways open, and you're actually closing them for a second while you clean them or change them or various things like that. And I did not like doing it, but it's something you have to do. You are also going to use a lot of equipment. There's like a Betty Boop machine that goes around people and shakes them until stuff comes out of them. So you're going to have a lot of equipment, and you're going to have a lot of education crammed into 2 years, and you're going to have to know what to do with them, and a lot of things to deal with. Breathing. Now, when I was at the hospital, we had one respiratory therapist per floor, unless it was at the ICU, and then there were 2 respiratory therapists in each ICU unit. So you're going to kind of be by yourself a lot of times, whereas the nurses kind of can rely on each other. There will be help as a respiratory therapist, but it's not as quick as a nurse. You're going to have multiple nurses on the unit. Whereas respiratory therapists, you're going to be, you may be the only one. Respiratory therapists came to every code call and rapid response call. A rapid response call, for those of you who don't know, is a call that the patient is having a medical emergency. Not necessarily, a code. Could be a blood sugar, could be, issues breathing, something that the nurse needs help with immediately. The respiratory therapist always came to those calls. So you're going to get a lot of work. You're going to work really hard for what you got, and you're going to see a lot of gross stuff come out of people. I hope that helps. That is what I know about respiratory therapy. That's it. I know I left some stuff out, and I apologize for doing that. As I said, I am no expert. Thank you much. Hope it helps.